Hello, everyone, and welcome to tonight's webinar from Henry Schein. I'm very excited about tonight because often we talk about air management, but now we're going to be talking about water management, the two elements needed for life and for dentistry. So we can't ignore either one of those. So it's very exciting for me to have Amanda Hill with us. Amanda Hill is a registered dental hygienist. She's an author, educator, entertainer, presenter. It's been a pleasure to get to know her. She's also a member of the advisory board of ADHA magazine and also hosts her own podcast, Your Dental Top 5, on the Dental Podcast Network. And that happens every Thursday, so I definitely check that out. I want to let you know there's no CE for this course tonight, and it's sponsored by ProEdge Dental Water Labs. There is a question and answer at the end of this program, so if you have any questions, please type those into the Q&A section at the bottom. With that, I want to welcome Amanda. Thank you very much for joining us tonight, and we look very much forward to your presentation. Amanda, take it away.
Well, I am super excited to be here today, and anybody that knows me well knows that I sort of have this odd passion for dental unit water lines, so I'm really excited to share this information with you. So the title of today's webinar is The Critical Role of Safe Dental Unit Water Lines in the Era of COVID-19. But truthfully, not a lot has changed before and after COVID-19. Dental unit water lines is something that's super important to our safe operating procedures and to know that we're going to have a safe visit. So by the end of today's webinar, you should be able to understand the importance of clean dental unit water lines. You should be able to define the steps needed to pass the test and to discuss the products on the market that can make your protocol successful. So first, let's talk about why are we testing dental unit water lines? I don't know about you, but I went to school in the 90s and we never discussed the water in our lines. We never discussed testing it. The only thing that did come up was that we should purge our lines at the beginning of the day. But I had a professor tell me that one time a spider crawled out of her air water syringe. And so I was really under the impression we were purging those lines to make sure that spiders didn't come out. But truthfully, we're doing it for way more reasons than that. The first one is there's biofilm that grows in those dental unit water lines, just like the biofilm that's growing in our patients' periodontal pockets that we're concerned about. We want to make sure that we aren't leaving biofilm in these lines. That biofilm can affect our patients' health. Here we are trying to be healthcare professionals, trying to make our patients as healthy as possible, and we could possibly be affecting them by the quality of our water. Something that we often forget about is our own health. And so what does contaminated dental unit water lines, how does that affect our health? And if the top three don't convince you, the CDC, the FDA, OSHA, so many other organizations say we have to be doing this. So we all need to get on board. So why on earth is there biofilm in these lines? How did it get there? I mean, I certainly didn't put it there and you didn't put it there. It's the high surface area to water flow rate ratio. So what that means is, our dental unit water lines are tiny. There's these tiny little tubes. And so the water, instead of like when it's a big tube and it might not really touch the edges as much, or they might be copper. So it's touching all the lines. And so it's able to leave biofilm along the way. And you can see some of these pictures here, and those are some pictures of biofilm that people have gotten from their dental unit water lines. So that microbial biofilm loves that small tubing, and particularly that rubbery tubing that we have. It's just a great material for biofilm to stick. Now this is fascinating. This was a study done by Barbeau and a whole group of people, and they figured out that bacteria can reach 200,000 CFUs in less than 5 days in brand new lines. So let's say you open this brand new office, right? And you think, okay, well, we got a little while till we have to worry about dealing with our dental unit water lines because these are brand new. In 5 days, it gets to 200,000 colony forming units. The acceptable amount per the EPA drinking water and per the CDC is only 500. So 500 versus 200,000 in only 5 days. So this is something that we really need to be watching out for. It's a big deal. the reason why that biofilm likes to form is that dental unit water lines are way less like that stream you see on the left that's flowing fast and the water's going, it's rushing, so the bacteria doesn't have time to stick. And they're way more like that pond that's on the right. And I don't know about you, just looking at that picture of the pond, like I feel like I can smell it, and that's not water that I would want in my mouth. It's not water we want to put in our patient's mouth. So we really want to make sure that that water that we're putting into our mouths, our patients' mouths, is safe. So what is in this water? What are these biofilms? So it's really a whole slew of things. And frankly, most of it is not a big deal. It's not going to hurt you, but there are a few out there that, the few things that are in there. And the top three really are Pseudomonas aeruginosa, non-tuberculous microbacteria, and then Legionella. So those are kind of the three that we're most concerned about, and the three that we've seen cases affecting patients. Speaking of that, here's things that have happened to patients in the news. These are ones that have made the news story. In Rome, Italy, an elderly woman died of Legionnaire's disease in 2012, and they tracked that back to the dental unit water lines. In Atlanta, Georgia, you might have heard of this case. In 2015, 30 children were affected. And the big one that made lots of news, and I think it's one that kind of woke us up to the importance of dental unit water lines, something we hadn't heard of already, is the case in Anaheim, where 70 children were affected by contaminated dental unit water lines. And it was definitely linked back to that. So let's look a little bit more at the why. Like Mimi Morales, this is Mimi, and Mimi was one of the children that was affected in the Anaheim outbreak. And it's just such a heartbreaking story. So in goes little Mimi to get a pulpotomy, a baby root canal. It's sad enough that she has to get a baby root canal, right? The hygienist in me just thinks, oh no, we don't want that. But so she goes in to get this baby root canal, and we want to keep her safe. We want to keep her healthy. But instead of getting healthy, she develops a serious infection in her mouth. And part of her jawbone had to be removed. And she spent over a month in the hospital and received heavy doses of antibiotics. And if any of you are big into antibiotic stewardship, I know that hurts your heart that, this little 7-year-old is already, affected her gut microbiome with all of these antibiotics, let alone everything else that happened to her. So how could something like this happen? So let's break down the Anaheim outbreak. So first, Mimi goes in, she gets this pulpotomy, she gets really sick. Her parents, of course, bring her to the hospital. And she develops this infection, and so they treat her. Mimi spends an entire month in the hospital, like I said, with those heavy doses of antibiotics. Then this is where I think it gets really fascinating. So the next child that comes into that same ER happens to see the same doctor that saw Mimi when she came in. And this great doctor thinks, wait, I've seen this. Hang on. And she starts to connect the dots. And she says, wait, have you been to the dentist? And then they start to connect the dots. And in the end, 70 children ended up being affected and hospitalized because of this group's dental unit water lines. And the really fascinating thing is, and I want you to listen to this because it's interesting, the symptoms showed up 1 to 409 days after treatment. 409 days later, some kid got sick from that pulpotomy. And so sometimes that's why, this is so hard to track, because who's going to think, hey, did you go to the dentist 409 days ago? But really, this is how it happened. And so as more children came forward and they saw that they were able to link them back to this practice, so this dental group was exposed, and they were shut down. And then the news got a hold of it. And I mean, it was big news, NPR, CBS this morning, LA Times, they're all covering this case. And so these practices were shut down, lawsuits were filed, of course, and these lawsuits are actually still ongoing, particularly with COVID, that pushed things off. And so they won't even go to court until January, I think. So this is a big deal. And it's certainly never anything that you would want to happen to your practice. That's not why you want to be on the front page of the paper. You want to make sure that you're safe. And it's not that hard to take care of these things. So we're concerned about our patients' health. But one thing that I think as healthcare professionals, we often forget, we put ourselves last, we forget about our own health. And COVID, I think, really has brought to light aerosols. Like all of a sudden we're like, wait, aerosols. Any of us that have ever used a Profi jet, with mint prophy powder. We know aerosols, right? You put in that mint prophy powder and you go to start prophy jetting and you can taste the mint, right? Mask and all, but you can taste the mint. So you know that we are inhaling these aerosols. And so we now have this thing kind of, this aerosolophobia, right? We're a little afraid of these aerosols. Well, this is a fascinating study that just came out and it's just about to be published in 2020 that shows that there's very little evidence that shows that the primary source of aerosols is from the patient's mouth, but there's a lot of evidence that's showing that the aerosols are actually coming from contaminated dental unit water lines. So what that means, what I'm saying to you, is what we're breathing is our dental unit waterline water. And so what's in your dental unit waterline water? If we go back, a few slides and we think about that, those bacteria that we're growing, the ones that can make people sick, well, oh my goodness, can they make us sick too? I'm sure many of you have seen this slide. The US Department of Labor put it out. I'm gonna move my mouse here. You can see dental hygienists are here. So this is the occupational risk score. So, this wasn't a contest as dental hygienists that I wanted to win, but here we are at the highest risk occupation, and our dental assistant friends are not far behind us. And oh, Dennis, you're right here too. So we're at a pretty high risk for contracting COVID, contracting anything that's aerosolized, because that's what we're breathing. And until now, we never thought about N95s. Who gave that a thought? I think we're lucky if we were actually wearing a level 3 like we were supposed to be wearing. So certainly some good awareness has come out of the COVID crisis. So what are we breathing? Okay. So a limited number of studies have shown that in 1988, dental professionals had the highest prevalence of Legionella antibodies. So when they tested a whole bunch of dental professionals, they had way more Legionella in their body than your neighbor down the street that's a banker. And so what that's saying is we are just slowly breathing in all of that stuff through our daily work. And that's a big deal. The CDC has said that exposure to contaminated dental water may lead to the exacerbation of asthma and other onset respiratory conditions. So think about that last time you had that upper respiratory infection. Was that because you just got it at Target? Or is that because your water lines might not be clean? And what are you breathing in? So it's really something to think about yourself, because I think that we often forget ourselves. So if it's not enough to think about the biofilm and not enough to think about the patient's health or your health, there is a lot of alphabet soup of organizations that say that we have to do this. The CDC, OSHA, OSAP, ADA, ADHA, your state dental boards. So many people are saying that this is something that we have to do. So how do we do it? All right, it's time to crash the biofilm party. So that biofilm, it is hanging out in those dental tubes. When we shut down those offices for COVID, I got to tell you, biofilm was never so excited, because it just jumped in those dental unit water lines and it multiplied and multiplied and multiplied. So we need to break up that party. So how are we going to break up that party? The first thing we're going to do is we're going to use shock. We're going to use a strong disinfectant to clean those lines. Then we're going to test it to make sure it worked. And then we're going to treat it with a low-level antimicrobial. And then we need to determine our SOPs, our standard operating procedures. So how we're going to maintain these dental unit water lines. Okay, so first we got to shock. So this baby's shocked, right? We're shocking our baby. So the first thing we want to do is you want to shock before you start any new treatment, because when we talk about treatment, and we'll get to that in a minute, you always want to treat on clean lines. So you don't want to start on dirty lines. If your office was closed for a certain amount of time, I'm sure it was a few months, if you haven't gotten back in yet, you definitely want to shock first. If you started back and you didn't shock, you probably need to run in over the weekend and do a good shock, because again, that biofilm had a party while we were hanging out for COVID. You want to shock at least every quarter, and you want to shock when your water line test reveals a contamination over 200. Now you might say, wait, hang on, back a few slides ago, you said 500, that the EPA and the CDC say 500 is acceptable drinking water. And that is totally correct. Yes, a test will show that you have passed if you are below 500. However, I want you to think about it this way. As soon as you get to 200, that biofilm is starting to grow, right? And we know that biofilm only loves more biofilm, and it loves live biofilm, it loves dead biofilm, and it eats it up, and more biofilm grows. So how about we take care of it at the 200 level, as opposed to waiting till the 500 level, and then we might fail and we might have to deal with it a little bit longer. I sort of think of it like a 3-month prophy or 3-month perio maintenance visit, as opposed to a 6-month perio maintenance visit. So I want to attack that biofilm before it gets really, deep into that pocket and really gets mature. So let's get it when it's still able to shock it out. So how do we shock? This is a super busy slide. Feel free to screenshot it, but I also have to tell you, you can easily go online to find instructions on how to shock. ProEdge has a great explanation on their website for how to shock. But the first thing you want to do, the disclaimer at the bottom, is always check your instructions for use. Make sure, if you're going to choose bleach, which is actually my favorite to use, it's cheap, it's fast, it's easy. If you're going to use bleach, make sure you check with your dental unit manufacturer to make sure it's okay. Some say yes and some say no. But the basic bleach shock is, first you want to figure out what is your dilution of bleach, because there's different ones. But you want to make sure that you're using regular plain old bleach, not the splashless kind. For some reason, the splashless kind doesn't do the job. So you want to mix your dilution, whatever it says. You're going to pour a little bit of that into your water bottle, your dental unit water bottle. Now, one thing to note, if you are already doing some sort of dental unit waterline treatment and you are using a straw, I want you to take that straw out and put in a dummy straw. If you don't have a dummy straw, ProEdge, you can email them. They'll send you a dummy straw. I actually have a bunch around. If you live near me, I can give you one. Because you don't want to run bleach through your straw. It'll ruin your straw. So you don't want to do that. So you reattach your bottle and you run that bleach through every single line. And when I say every single line, I mean all the lines that have water in them. So that might be your high-speed handpiece. That might be your air water syringe. That might be your power-driven scaler. So whatever has water that comes through it, you need to do all the lines. And even if there's a line that you never use, like I have a high-speed handpiece tube that would connect to a high-speed handpiece, but I never use it, the water still sits in there. So you need to also run that one as well. So you're going to run it until you can smell the bleach. And if you can't ever smell the bleach, you actually can feel it, even with gloved hands on. And I want you wearing PPE when you're doing this, when you're shocking. I should have mentioned that. Because again, what are we breathing in, right? So I want you to think about your health while you're taking care of your water lines. So you can feel that it kind of gets slippery. And then you're going to leave that in for 10 minutes, never more than 15 minutes. So really seriously set a timer, use your phone, you do whatever. Don't think, oh, I'll remember. Because if you put it in for too long, you could hurt your lines. So once that time's up, you want to disconnect your bottle and dump it in the sink. Don't suck it in with your suction. You'll destroy your suction lines. Okay, so pour that down the sink and then refill those bottles with warm water and then flush those lines again until that bleach odor disappears for 1 to 3 minutes. Now, your ultrasonic scaler will take forever. I remember the very first time I did this and I sat there with the ultrasonic scaler because the water doesn't come out all that fast. It kind of comes out drip, drip, drip. So it took a long time to get the bleach smell. And then it took forever to rinse out the bleach smell. So just know you're in for the long haul, but it's really an important thing to do. So don't skip it. Okay, so we've shocked. Now we got to test. Thankfully, testing is not as hard as a Scantron. It's actually really easy and pretty fun. So OSAP recommends that you test every 90 days once you've established a good protocol. In the beginning, if you've never done this before and you test the first time and you pass, you actually want to wait until you have two consecutive monthly pass tests, and then you can move to quarterly. So you can do in-office or you can do mail-in. They're both great. I actually really recommend once a year to do a mail-in, and then the other 3 times a year you can do an in-office test just to make it a little easier. So pooled sampling is an option, and it's actually a way to save some money. Some people are all for it, and some people are like, I don't like it. So decide, what's best for you. But what a pooled sample is you take that vial where you're collecting the water, and you could use that from 3 to 4 different lines in a single operatory. Don't do one for the whole office, because then if something fails, you don't know where it failed. But The whole point being is if you do a pooled sample and it fails, you're going to shock the whole unit anyway. It's not like you're going to shock one line. You're not going to shock your air water syringe. You have to shock it all. So if you fail, the whole system fails. If you pass, the whole system passes. And you just spend a whole lot less money on tests. Okay, so collecting your sample is super easy. So what you want to do first is flush your line for 1 to 2 minutes, just like you would do at the beginning of the day. And the reason that is because you want to make sure that you're testing the water that you're using on patients. So, so you want to, again, wear your PPE, and you're going to put that water into the vial, whether you're using a pooled sample or whether you're just doing it singularly. So in-office testing. So these are 2 different in-office testing paddles. There's some good advantages to in-office testing. The first time I ever tested water, I did in-office. And the nice thing is it's 100% confidential, because I'm going to admit something to you. The first time that I tested water, we totally failed. I had actually never heard of water testing, and I went to my regular yearly OSHA review, and the guy started talking about water testing, and I was like, ooh, I don't think we do that in our office. So I went back to my office the next day, and I was like, hey, we're supposed to be testing our water. And they're like, okay, you're it, which turned out to be great. So then I ordered some paddles, and we got going. So, so yeah, totally failed the first time, and then had to go back and figure it out. So thankfully there's lots of information online. So one downside to in-office testing is it's kind of imprecise. You don't get those exact numbers. You really just get these dots on a paddle that you're looking at. And so if there's a lot of dots, you know you failed. And if there's not many dots, you know you passed. But you don't always know the exact number, which is really nice about a mail-in test. It's way more economical. It saves you money. You don't have to deal with overnight shipping, which you have to do when you mail it in. So, and since OSAP recommends that higher testing frequency, this is a way to get in that higher testing frequency without breaking the bank. And you get your results from an in-office test in 2 to 7 days, depending on which paddle you choose. So mail-in testing. A cool thing about mail-in testing is you get that third-party verification. And I gotta say, when you do that, when you do a mail-in test and you get that third-party verification pass, show your patients. Patients are all about infection control right now. They wanna know. I mean, I get phone calls from friends all the time, like asking me, okay, what should I be looking for at my office? What should they be doing? And so patients are far more aware of infection control measures that we're taking. They would love to know that you are testing your water and that you have passed. So put it on your social media, put it out, you know, have a little certificate out for your patients to see. Your mail-in testing results are more precise. Like I said, with the paddle, you know, you're just kind of like, oh, that's a lot of dots. Not too many dots. Your mail-in ones are going to tell you exactly how many dots, how many colony forming units you have. A downside is overnight shipping. You know, it does get expensive, and you got to make sure that you get those right in and do that the right way. But you get a report emailed to you, and then these results come back in 1 to 7 days, depending on which mail-in test you choose. And we'll talk more about that when we get into products. So we've tested. What do you do if you fail? I told you, not that scary. I've totally failed. There's a few things you want to do, and there isn't one necessarily more important than the other, but check for filters. So oftentimes there could be a hidden filter in the junction box underneath your chair. If you go in there, you might find this big white filter, and it might be gross. Your power-driven scaler might have this UFO looking type filter. I never even knew about it. I happened to be at a dental meeting and I was sitting next to the rep, and he all of a sudden mentions this filter, and I was like, filter? And I go in my office the next day and I find this little UFO looking filter, and it is black. No wonder my ultrasonic scaler kept failing. I would get it to pass and then it would fail really quickly, and it was the filter. So look around for a hidden filter that you don't know about. You can always try another shock product. So there are different shocks, some are stronger than others. So maybe you need a stronger product. Maybe it just wasn't enough. The lines have been, you know, building that biofilm for far too long. You might need to check for dead legs. What a dead leg is the dead leg is a water line that goes to nowhere. It doesn't get used anymore. And so it might have just been capped off, like maybe where you would put in the handpiece. And so that water's been allowed to sit there and just get gross. So what I'd recommend for dead legs, if you see you have one, call your favorite Henry Schein rep and ask them to come out and actually cap it off so where no water can get in there. And then lastly, test your water source. This actually became a big issue with COVID. I don't know if you saw it, but even OSHA and different organizations were telling people that manage buildings, like full buildings, nothing to do with dentistry, that because these offices have been shut down for so long, that they need to run all of their sinks. So everybody needs to turn on all their sinks in this big office building, because that biofilm, because everything sat stagnant, even though these are big tubes, that was able to form in the big tubes because it sat for so long. So sometimes people are finding that their regular sink water might be contaminated because it's been able to do that in the pipes. Also, some people like to use distilled water, and for convenience sake, they have a distiller in their lab. Super handy to use for the autoclave, right? So you don't have to keep dragging all those gallon jugs in all the time. But oftentimes those distillers are actually totally contaminated, because think about them just like we're talking about our dental unit water lines. It has some little tubing, and little tubing equals biofilm. So take a time to check your water source. That might be one of the reasons that you're failing, because man, when you keep failing, it's super frustrating. All right, so you've passed, right? You passed the test, we shocked, we passed. So it's time to treat yourself. So first off, give yourself a pat on the back, because it's a big deal. Like, you did it. But that doesn't end there. We have to keep treating our lines. And I like to think of it like this. So shocking is like a perio maintenance visit. It's when I'm getting in there with my power-driven scaler, and I'm down in the periodontal pocket, and I'm breaking up that biofilm, and I'm getting things nice and clean, right? But treating with a low-level antimicrobial is like brushing every day. You would never tell your patient, you're good, I got you, I took care of you, see you in 3 months. No, they have to work every day to keep that biofilm, to keep that microbial load down. So that's why you're treating every day. So these treatments are good, but they're not perfect. So this is why we're doing it in conjunction. Just like the best brushing and flossing and interdental brushing is great, not perfect. So all low-level antimicrobial tablets and straws are awesome. They are fantastic. But science shows us that pairing it to straws or tablets together with a shock, you'll get much better results. So if you look at that first column, it shows you a tablet with a separate shock passes 88% of the time. Now, if you don't shock and you just use a tablet, you're down to 77% of the time. A straw, 72% of the time. If you're just shocking and that's all you're doing, you're passing 60% of the time. So, I don't know about you, but 60% was an F when I was in school. So let's put things together so we can have a higher chance of passing. So tablets. Tablets are super easy to use. It's how I started in treating my dental unit water lines. We got these little blue tablets, and we dropped them into our little bottles, and we screwed them on. So the way you want to do that is you want to look at your instructions for use on the box with the tablets, figure out how many tablets you need, because all of those bottles are different sizes, So you got to figure out, do I need 1 tablet? Do I need 2 tablets? What do you need? You put it in, you fill the water up, and you let it effervesce, fizz, like Alka-Seltzer fizz, right? And then you attach it. Now, this is an interesting thing that I never thought about, and thankfully my friends at ProEdge gave me this light bulb moment. So for the longest time, my power-driven scaler unit was separate from my dental unit water chair, or my dental chair. And it had 2 little water reservoirs. And so I was like, I need to treat those. Well, so I was taking the blue tablet and I was breaking it into quarters, and I was putting a quarter into each reservoir. And so I was telling them this, thinking I was super smart and super proud of myself. And they're like, why don't you just mix it up in a gallon jug, and then you can pour it in, and that way you have the right ratio. And I was like, oh, well, that's genius. So when you do that, you mix it into a gallon jug and you just pour it into the bottles that you have. Depending on what tablet you use, that water is good for 14 to 28 days. And you're going to go through it way faster than that. So, but you certainly can write a date on it so you make sure that you're in compliance. But super handy, a much smarter way to use a tablet. So if you're in a position where you can't use a straw, mix it up in a gallon jug and pour it in. So straws. So straws came out, and straws seemed like that is it. I get out of jail free. I never have to worry about my dental unit water for an entire year because a straw is good for a year. Well, it sounded really good, but like I showed you that slide a few back, a straw by itself didn't do the job. So the interesting thing with a straw is it says straws are good for a year or 240 liters. That's sort of like your new car warranty. It's good for 5 years or 50,000 miles, which 50,000 miles happened at year 3. So who on earth keeps track of how many liters you're using? So that's an important thing to consider with your straw. But straws still can be really effective. And the way you want to use a straw is you remove that intake straw and you put on your straw, put your bottle back on, and you can just fill it with regular water. I always just like tap water. But I want you to set a note in your appointment book for when your straw needs to be replaced, because we think we'll remember, but we really won't. And we all look at our appointment book. So we'll see that thing and be like, oh, it's time for the straw to be replaced. Unless our tests tell us it needs to be replaced sooner, and we'll get there. Okay, so we have figured out our treatment. We've decided whether we're using a tablet. We decided whether we're using a straw. So now we need to maintain this, right? I mean, we're doing good, so don't wreck it. Don't forget about it now. We don't do it once and it's done. So I like the idea of appointing a waterline warrior. Isn't that a fun name? I like being a warrior. So it does not have to be your infection control coordinator, although it certainly can be. And I hope you have an infection control coordinator. That's a very important thing. It's OSHA mandated. But it doesn't have to be that person. It can be someone else in the office that finds it fascinating, like me, and allow them to kind of be in charge. Establish your standard operating procedures, write them down, put them in your compliance manual, and then always keep records of what you're doing. My friends that are out there in infection control compliance are telling me that when the Board of Dentistry or when OSHA is making that visit to your office, one of the main things they're asking for is proof that you are taking care of your dental unit water lines. So it's important, and you don't want that to be the reason that your office gets closed. So this one is fascinating for me, and I got into, learning about dental unit water lines, and I didn't know this. I didn't know this until recently. Flushing versus purging, okay? So we talked about why we flush in the morning. It's spiders. No, it's not spiders, but we flush in the morning for 1 to 2 minutes, okay? Just getting out, whatever might have built up overnight. And then we always want to flush between patients. That I know. But I was purging at the end of every day, thinking, okay, so if I need to get as much water out as I can at the end of the day so that hopefully less biofilm will grow. Well, the new thought process is actually, no, don't do that. And the reason that is if you leave that low level antimicrobial, your straw or your tablet, you leave that water in your lines, it can keep fighting the biofilm while you're home binging on Netflix. However, we are going to purge over any extended absence, like COVID. And if you didn't purge and your office is still closed, all is not lost. You just are going to, have a lot more biofilm to deal with when you shock. But you can certainly go in and purge now. Actually, I would shock now. So these are a couple of myths. These are the big myths that I hear. I use distilled water, so I don't need to shock my lines or take care of them because the distilled water takes care of it. That is actually completely untrue. Actually, distilled water doesn't even have chlorine in it, so sometimes you can build more biofilm with distilled water. But use what your dental manufacturer, your chair manufacturer says to use. So if they say use distilled water, use it, but just know that you still have to shock and you still have to test and you still have to treat. Another one is the city water comes straight into our units, so we don't have to do this because we can't, we don't have a bottle. Well, that is also not a good excuse because biofilm can still build up in those lines, but you are correct. It is really hard to maintain your dental unit water lines when you don't have that bottle to be able to do it. So I highly recommend, once again, you call your favorite Henry Schein rep and ask to have your unit retrofitted. It's not very expensive. It's pretty quick, but that's something that will give you the assurance that you need to know that you're taking care of your patients. And remember, we're taking care of ourselves here too. We're the ones breathing this air every day. So products, let's get into some products. There's lots of products out there. They are all fantastic. But no matter what product you you must read your instructions for use. Any product that is out on the market came out with these instructions for use. It was approved because of the instructions for use. So if you do something because somebody on Facebook said this works, but it's not in the instructions for use, the product isn't doing what it was designed to do or how it was supposed to work. So it might not do the trick. So make sure you're checking out those instructions for use. Even if I just contradicted the instructions for use, go with the instructions for use. So shocking. So there's lots of different shock products out there. There's tons, actually. I mentioned bleach. It's easy, it's cheap, and it's fast. You do it and it's done in 10 minutes. Liquid Ultra by Crosstex is another great one. It's really strong. It does take multiple days. You have to leave it in there usually over a weekend, so it's a little longer. Citrosil is another one that people use. I will tell you the Liquid Ultra is like 4 to 5 times stronger than Citrosil. So if shocking is new to you and it's something you've never done before and your office is 40 years old, you might want to pull out the big guns to make sure that you're getting that biofilm out. So in-office test kits, this is, like I said, this is where I started, right? So the blue test is the Quick Pass by Pro Edge. And the red one is called AquaSafe. So you can see the difference in that picture on the top where you can see the dots. So the Pro Edge one, the colony forming units show up red or green or yellow, but on that white background, it's a little easier to see. The AquaSafe one, you can see they kind of turn out yellow, and then there's like one white one you can see, but it's a little harder to read. The Pro Edge one takes 2 to 3 days to come in, so 48 to 72 hours. You check it after 48, then you can let it grow another 24, see what happens. The AquaSafe one takes 5 to 7 days, so a little bit longer. Mail-in test kits are great as well. So like I said, I love to do that once a year, so you get that third-party verification. Pro Edge has a system that you can mail in, Loma Linda, and Agenix all have mail-in test kits that you can use. But there's a new test kit on the block. I hope everybody likes the new kids. I'm a kid of the 80s and 90s. And it's called Flow, and it's actually super exciting. And even if you don't get into like the nitty gritty science of like lasers and fluorescence and cell size, and it does really cool stuff, you're gonna find that it's absolutely fascinating. It's able to distinguish between viable cells and non-viable cells. And part of why that's important is biofilm loves to eat dead biofilm. And so the more dead biofilm you have, the more biofilm you're gonna have. Anyway, it's rather fascinating, and you get some really accurate results, and you get same day results, which is phenomenal. So we just talked about how we had to wait for the other stuff. So here's the big difference. If we look at this blue circle, right? So this is what Flow can detect in the way of bacteria, this whole blue circle. What we're using now, R2A, can only count 2% of known bacteria. So it's the difference between we're growing bacteria on these mediums when I'm using that paddle or I'm sending off that tube, they grow the bacteria. That's why it takes 2 to 7 days. Well, with Flow, they're counting the bacteria that's already present. So they're taking your water sample that you mailed out. Remember, overnight shipping, we mailed it out, and they put it in, and they're counting all the bacteria that's there. It's rather fascinating. So here's the big difference. So the HPC, heterotrophic plate count, that's what we're using now. That's those paddles or when they grow it. So it counts in colony forming units, but it only has one kind of temperature, only one temperature and only one kind of food. So only 2% of the bacteria can grow in it. Now, it's certainly the important bacteria. It's the one that we're learning about that can make people sick, but maybe there's more. Flow cytometry is an absolute cell count. It absolutely counts every single solitary cell. So remember when I said we were kind of guessing when we're doing that in-office test? There's no guessing here. This is all the numbers. It counts one cell at a time, super accurate, super precise. And it does it in 20 minutes. Now, 20 minutes from when they get it in their hands and they can test it. But still, it's a big deal as opposed to waiting 2 to 3 days or 5 to 7 days. And think about it. If you had an office that kept failing or an operatory that kept failing, and are you going to shut down that operatory and not work in that operatory for how long? And so by having Flow, and if you can mail it off and get that it's passed the next day, that operatory is back in action. Or if you can't shut it down, it's just impossible, and you're doing your best, at least you know, like when things are safe again, when you're breathing that fresh air, when you're not potentially infecting patients. So it's really important. The fact that you can get it fast is huge. Tablets, we talked about them. I've used the blue tab before. I talked about that. One thing I love about the blue tab, it's really fun. And I didn't learn this until I was talking about it to somebody. But I was using the blue tab for a while, and my water started getting fizzy, like, like almost effervescent, right? That's actually blue tab telling you that biofilm is forming. Is that amazing? So if you've been using blue tab and it starts to get fizzy on you, that's a sign, oh, when was the last time we shocked and tested? Ooh, we got to check on that. So it's really neat that it kind of talks to you. These are some of the straws that are out on the market. Crosstex, Fridi, Sterizal, they all have a straw. These are the 1-year straw. So we put it in, and supposedly we're good for a year, but remember, we don't believe that, right? We're still gonna test, and we're still gonna shock. But there's a new straw out on the market. So ProEdge just came out with the blue tube. And I'm sure you look at that and you're like, wait, there's 2 of them. Oh, it's good for 2 years. Actually, no. It's actually sort of like a recall. So you're gonna change it every 6 months. And you're like, wait, every 6 months? I don't want to do more work. Now I got to remember twice a year, but this is why. And this is huge. So when we look at this orange line. So orange line, these are your traditional straws, okay? And so here we go. We know that failures dramatically increase when we get below 1 part per million. So here's the 1 part per million line. And here's a traditional tube. Oh, it falls below the 1 part per million line, right? Like after the 6-month recall, right? So ProEdge saw that, and they saw all these failures coming in because, they're the water testing people. And so they said, wait, what if we go through and we change that at 6 months, and we go all the way back to the highest amount of iodine again, and we're able to do it again. And that way it stays above 1 part per million. And so you're more likely to pass your test, which is huge, because that's what we want, right? So let's review. What do we have to do again? Because we talked about a lot of stuff, right? There's a lot to remember. So first, we want to shock. You have to start with a basic shock. If you've never done anything, that biofilm had a party and we need to evict it from the party. So we got to shock. So you pick your solution. Are you going to, do a bleach? Are you going to use one of the other products? But we're going to check with our dental unit manufacturer because we know that's important, right? Then we're going to test, whether we do a mail-in test, whether we do an in-office test, and you're going to make sure that you document that, because if you didn't document it, it actually didn't happen, just so you know. Then you're going to choose a maintenance product, and you're going to use it every day. And you need to make sure that your whole team's on board, that they understand why they're using this maintenance product, how to use the maintenance product. Because again, we know that just shocking is not going to keep that biofilm away. And we know that just using a maintenance product isn't going to keep the biofilm away. So it needs to work in conjunction with each other. And then we're going to flush our lines. So at the beginning of each day, you're going to flush those lines for 2 minutes, make sure there's no spiders, but actually the biofilm. We're going to get that out, and then we're going to flush for 20 to 30 seconds in between patients. We're just keeping everything safe, right? Now, this is something that I just learned, which I think makes perfect sense now that I heard it. You're going to retest on the last day of every quarter and document it. And then on the first day of the next quarter, you're going to shock. Now, this is why, because you're like, wait, what? Why aren't you said shock and then test? I said shock and then test when you're establishing your protocol or when you're opening your office back up post-COVID, okay? But when you get into that regular protocol, that regular maintenance schedule, and you are passing your tests, you've had 2 months of consecutively passing tests, and now you're ready to start your quarter system. This is why. So if you retest at the end of every quarter, you are testing the water that you have been using, and you know if your treatment method is effective. You know that that tablet's doing its job. You know that that straw is doing its job. Then you do a shock, because even if you pass that test, you still have biofilm has grown. No matter how clean or no matter how awesome we are, the biofilm's coming, just like in our periodontal pockets, right? The biofilm, blah. So you still want to test, and then you want to shock on the first of that quarter. And so then if you can follow all of those things, I got to tell you, you'll be golden. And if you're having trouble, I got to tell you, the folks at ProEdge have been amazing for me. You send them an email and they actually respond to an email, and then they'll actually talk to you on the phone, and they have great printables that you can go to their website and print out some things that you can use for documentation, that you can, write down your testing scores, and you can put that right in your office manual. Really handy ways to make sure that you're keeping track and you're on the ball. So thank you so much, everybody, for coming with me to learn all about dental unit water lines. And I hope that you've learned a thing or two, and happy to answer some questions.
Amanda, thank you so much. That was great. You lived up to my term entertaining at the beginning. I just want to continue to listen to you. So we'll continue with some questions and answers. We had a wonderful discussion on both chat and on the questions.
Awesome.
So if you would, I'll just read some of the questions. Can you use tablets and the straw at the same time?
You know what? You don't want to do that. Sometimes too much is a good thing, or too much of something is a bad thing. So one is plenty. Using both is not a good choice.
Diminishing return, right?
There you go. Thank you.
Yep. We have a Vista pure filtration system in our office, and we fill our water bottles every morning and empty them in the evening. Do we still have to shock our lines?
So I'm not super up on the IFUs for Vista. Gary, do you know more about them?
No, I don't.
Okay, so first off, I would say read the IFUs. Read those instructions for use and see what they say. I did a little bit of research once upon a time on Vista, and I got to tell you, my mind is drawing a blank on the right answer there. But I would be, if you want to email me, I will research it, and I would be thrilled to give you that answer. So if you just email it, amandahilldh@gmail.com, shoot me that question, and I will look into it and get back to you.
Great. We have a request for you to put up a slide. We'll do that at the end.
Okay.
On shocking again.
Oh, yeah.
Here's another one. I have old units directly plumbed to municipal water. You've addressed that. I put the Stericyl cartridge in line after shocking with Citracyl. Is it a mandate to test or a recommendation? Number one.
Okay.
And am I breaking a law?
State, right?
Okay, so check with your state. Am I breaking a law not to test? These old units have multiple dead legs, I'm pretty sure.
So I think you answered your own question. So sometimes, even if there's not a law in place, there's definitely recommendations in place. And the recommendations are there for a reason. And I'm concerned about not just your patient's health, but again, we have to think about our own health and what are we breathing in? And we're there all day. So yeah, you might think about, it's not expensive. It's pretty easy to do. And I know your favorite Henry Schein rep would love to come and see you and retrofit those units so that you can know. That way you're not even worried about it. But you can always test and see. If you're really curious, if you're like, okay, well, I think this Vista is doing its job, then
right. Show
that your Vista is doing the job.
Proof.
Yeah, I know that in the state of Virginia that they, the dental board will come and check to see whether you're doing your water lines. So you can get.
And you had also mentioned OSHA is now picking up some of their inspections, and that would be one area they look at. It's documentation on the water lines.
Yeah.
That leads into, you mentioned the in-office and the mail-in water testing. What is the cost differential? Not specifically, but in general.
It's actually not hugely different. I think it's probably depending on how many tubes, maybe in the $50 to $60 range difference. So it's not gigantic. Yeah, so it depends.
Now with the flow system, it's much more efficient, correct?
Yeah, the flow is really exciting. So I'm excited to see sort of as they build data and as they learn more and more and more bacteria. I'm going to have to learn how to say more really hard names of bacteria, I bet.
You did very well earlier.
Oh, thank you. I practiced a lot.
And what is the difference between flush and purge?
Okay, so flushing is there's water in the lines and you're letting some of the water come in. It's like turning on your faucet. In my bathroom, I have to leave it on forever so the water will get hot. That's kind of flushing, right? I'm getting out any water that's been hanging out in there. Purging, I guess I didn't explain that well. I forgot. You turn off the unit. You empty that water bottle. You turn you empty the water bottle, and then you just blow it and blow it and blow it until all the air and all the water's out. So you're trying to get that unit as dry as you can, but no matter what you do, you're never getting it completely dry. But for the longest time, that's what we thought. And in fact, there was an article that just came out in a magazine that I was reading that it was saying to, purge your lines at the end of the day. And so this new thought process about leaving that antimicrobial in the lines makes a lot of sense.
Great. A question is, should we flush before we take a water sample?
Yes. Yeah, because you want to do that because you want to test the water that you're using in your patient's mouth. And so you're flushing in the morning anyway, right? Yeah. So if you were just to flush with your first morning water, that's not what you're giving your patients because you're doing a 2-minute flush in the beginning of the day. So do a 2-minute flush and then go ahead and take your sample.
Okay. And you talked about regularly shocking the system on a annual or biannual area. Here's a comment of, I thought shocking is hard on the system and you're only supposed to shock if your numbers are too high or you fail, essentially.
Yeah, so I thought that too for a long time. And then as I've looked at more and more research and data, shocking is really the only way that you're going to keep that biofilm down. Now, if you're super uncomfortable doing that and you manage to have, your system, you manage to test and you're managing to keep it in line, that's certainly a system that you can put into place, but you have to, no matter what, you have to be testing quarterly, because if you're not testing quarterly, there's no way you know whether your water is safe or not.
And again, you mentioned always follow the instructions for use from the manufacturer. So reach out to them as well.
I have to put that baby back up again, reading that book. I will.
Yeah. What about mobile units?
I don't know a ton about mobile dentistry, and that's something I'm fascinated by and want to, but without a doubt, you have to do the same types of things. You're going to have to be following, you're going to have to be testing. And then there has to be a way to shock that mobile unit. And I got to tell you, either talk to your manufacturer or the people at ProEdge, like I said, their customer service is just bar none. They are the nicest people in the universe, and they can definitely walk and talk you through your system. I imagine they've seen it and they've heard it and they have some experience with it. We
definitely want to thank ProEdge for putting on this webinar and bringing you to us. So that's wonderful. Question on the timing. A quarter is 3 months of the year. Every 3 months you put the timing in. So the question with aerosols, where is the best place to store empty bottles at the end of the night?
So remember we talked about we're not taking the empty bottles off anymore. So you leave them screwed right in place with that water that has that antimicrobial treatment in it. So once upon a time, yes, I would have said that you leave them, upside down in your sink or, on a paper towel. But that's not what we're thinking anymore. Now new science is showing us that you leave them in.
Yeah, good. And I think you answered this, but to refresh, what do you think about pooled or combined samples? So you mentioned per operatory.
Yeah, I think they're great. You want to do it per op. You don't go off the whole office. My last operatory had, I think I mentioned it, had a unit. My dental unit, my chair, but then it had a separate power-driven scaler. And I think I would do those two separately only because those are indeed two different lines. They don't come from the same water source, but if it all shares that same water source, you're going to have to shock the whole thing if it fails anyway. You can't shock one line.
Right. For not purging, do you have the reference for that article you had mentioned on not purging or the science?
I do not, but I have no doubt that I can get that for you. So again, if you want to shoot me an email, we can find that.
Okay, perfect. So this is a good one too, which I think is probably a majority in dentistry, unfortunately. If we've never tested our water lines, how do we start?
Yeah, so it's exciting. You start just like I said. So the first thing you want to do is you want to shock, because if you tested first, I promise you'd fail, just like I failed. So first shock and use one of the big guns, like I talked about, and then figure out whether you want to start with an in-office because you're kind of a little shy and you don't want people to know what you've done. Start with an in-office and see how it looks. Count those colony forming units and see how you're doing. And then what you want to do is you want to make sure that you pass for 2 consecutive months, and then you can move to a quarter system. But you want to make sure that you know, that biofilm, like I talked about, old biofilm, new biofilm loves to eat old biofilm. So you want to, it can bounce back so fast. If you remember that one stat I showed you at the very beginning that said it brand new dental unit water lines, 200,000 colony forming units formed in 5 days. Like, that's insane.
Yeah.
So, yeah.
And
So
then
just start with a
you
shot.
also, perfect. And ProEdge has information on that as well.
Oh my gosh, they
correct?
have
How to start
their
up.
blogs, their information on their website is so great. And frankly, they would just talk you through it too.
Yeah, perfect. We don't have water bottles. How do we retrofit?
You call your favorite Henry Schein rep and then we'll make
Good
that
answer.
happen for you. Am I right?
Yeah, you're right. Should we shut down an operatory after a failure until we get a passing result?
So I can't tell you what to do. I wouldn't want my grandma in a chair with a failing operatory. But I haven't seen anything written or mandated. But that's where that flow, that new water test really seems like such a great concept, because you can, you know, you fail, then you can shock, and then you can test and know that you're safe, so you can reopen that operatory safely. So yeah, I'm not comfortable telling you what to do, but I would say that, you know, just give it some thought.
Yeah. And you had mentioned, or one of the questions too is, does this apply to oral surgery, which may have its own sterilized water line, right?
Oral surgery, yes. When we're doing different procedures, there are procedures that require sterile water. And so that is totally, that has its own little tubing, its own little thing. We are not talking about that.
Are you testing that at all, or how do you confirm it's sterile? Do you know?
That'd be kind of fun. I can't say I've ever tested sterile water. I just trust
Okay.
that bag when it comes, but maybe we should be testing it. That's a good idea.
Yeah. Okay, and we have straws, and we've had a series of failures. Is there somewhere we go to get specific advice for straws?
ProEdge, call them.
Okay.
They will totally help you. But wasn't that a fascinating fact though, about the 1 year or 240 liters? Like I was like, oh, 240 liters. How the heck
do you know?
I don't know. Like I just filled a bottle. So yeah, and it could be it's not your straw that's failing. It could be one of those other things I mentioned. It could be your source water. It could be a dead
the
leg.
filter, right?
It could be that crazy hidden filter. I got to tell you, somewhere in your junction box there is some funny filter that you never even knew about. So it could be a lot of reasons. The folks at ProEdge will really talk you through all of those different what ifs. They're really handy like that.
And is Flow out now or available?
Flow is out now. Yeah, it came out August 1st. So it's brand new. You guys are cutting
that's
edge.
Wonderful. And what's the cost difference, people have asked, between, we know you mentioned a little bit, but between Flow and the 24-hour?
Yeah, I have not seen the price sheet, but from what I heard, it's very comparable to their current mail-in testing now. It didn't change much at all. And
when you get an email report from ProEdge, that's your documentation. You don't have to wait for anything mailed to you or anything else. They tell you right away.
This is fascinating. There was a compliance consultant, I think in Maryland, and she had an office that got shut down because of their dental unit water lines, right? And they were able to use the paddle and show and take a iPhone picture of their passing paddle, and they were able to open up like that.
Oh.
So that's documentation. So when you're doing those in-office tests, use your iPhone and take pictures of that and keep that documentation. So not just like, yes, I passed, but take a picture of those. It's a great way to be able to, just have more documentation.
One of the tips, I'm just going through the chat a little bit just to, some are hesitant to ask questions, but it's pretty interesting too, is some of the providers use their loops to read their in-office to differentiate.
So fun. Yeah. Really though, I got to tell you, if you need loops to count them all, if there's that many, you failed.
Great.
So.
Yeah. And I want to thank you so much. It's been very entertaining, very educational. It's something dentistry needs. Sometimes we, just forget about that we use so much of. I do want to emphasize Amanda Hill, rdh@gmail.com. If you have any other questions, you don't mind people reaching out to you.
Please go ahead and reach out.
Great. And please check out the ProEdge website for that. So again, I want to emphasize how entertaining it has been to listen to you and the expertise. It's wonderful to know you and share you with the audience. We have a great group
Thank you so
that are
much.
attending. So thank you. And I wanted to specify, if you have any questions or concerns or topics for upcoming webinars, please email us at webinars@henryschein.com. And if you go to our YouTube channel on Henry Schein, you can see recordings of different webinars, but certainly keep up to date on everything that we offer. And let's see if we did that. Well, you've answered every question. I appreciate that so much, Amanda. Yeah. Now you can get out and enjoy your kids. All right, everybody. Good night. Thank you so much.
Everyone, thanks for tuning in.
Bye-bye.
Bye.